What is the real truth about COVID vaccines? Are there any side effects? And what does mRNA do?
To the one who dares to know the truth, what you were told about the COVID vaccines was polished, rehearsed, and sold as salvation. But behind the curtains of pharmaceutical giants and media campaigns lies a much deeper story, one involving experimental technologies, suppressed data, and an agenda that has very little to do with health. The real truth, the mRNA vaccines were not just injections, they were the beginning of a new era of biological programming. Let's begin with the mRNA itself. Unlike traditional vaccines that introduce a weakened virus to build immunity, mRNA shots program your cells to produce a synthetic version of the spike protein found on the virus. Your immune system then responds to that protein as if it were under attack. It sounds innovative until you realize what's really happening. Your own cells are turned into spike protein factories, producing a substance never naturally meant to be made in that quantity or duration. This spike protein has been linked to a host of side effects: myocarditis and pericarditis, especially in young men, blood clotting and vascular inflammation, neurological issues like numbness, brain fog, and even seizures, and immune system suppression leading to unusual infections or viral reactivations. Pfizer's own early release documents, which they wanted sealed for 75 years, revealed over 1,200 deaths and thousands of serious adverse events within the first 90 days. The media buried it. Regulatory agencies, heavily funded by pharma, turned a blind eye. But beyond the physical risks lies a deeper agenda. mRNA technology isn't just medical, it's programmable. This opens the door to digital identity tied to vaccination status, real-time biological tracking already in test phase, and perhaps most chilling, future platforms where your biology could be updated like software. You weren't just given a shot, you were enrolled in a global trial, and many didn't even know it. So why the rush? Because control works best when disguised as care. Fear was the sales pitch, safety was the slogan, but what you really received was the first step toward medical transhumanism. Final truth, not everyone who took it will suffer, but everyone who did became part of an experiment with no long-term data. And while the mainstream still clings to the script, millions are waking up. The silence is breaking, and the truth, cellular, political, and spiritual, is being seen for what it was: a test of consent, courage, and clarity.